Welcome to Convergence Healing with Peter Bedard, where we empower you to heal your pain on every level of your being, body, mind, spirit. Our show is about sharing solutions for creating the life you want. We invite you to stand up and choose a life of health, happiness, and joy. And we're here to show you how. This is Convergence Healing.
Awesome. Welcome back to the Convergence Healing with Peter Bedard podcast. I say that too fast, don't I? Convergence Healing with Peter Bedard podcast. How's that? Yeah. So before we get started and I bring on my amazing, I love amazing. Amazing is my word lately. I've been using that word a lot, I don't know what that's about, but I really do. People think that the guests on my show are amazing, so I think it's an appropriate word. We're going to get to the amazing Dr. Clement Lee in just a moment. But I always try to bring in a quote, something from my work or somebody else's work that sort of helps me connect with my guest. So this is a quote from my book, Convergence Healing, Healing Pain with Energetic Love. And I'm going to read it to you guys. All right, here we go. Once I was able to make the tiniest bit of space for the possibility that there was some good in what happened, I began to open and free my mind. I often tell my clients that I am grateful for the accident that killed me. If it was not for that experience, I would not be here with them. So that's that really sums up a lot of my life. And I'm here for you guys. I'm here because, it wasn't my time. And when I came back, I had no idea what to do. So the universe, I like to say, guided me to people like Clement. It guided me to people like Reverie, who are really excited about sharing this healing work and the possibilities for health and wellness for our community. So with that, I would like to bring to you Dr. Clement Lee. Dr. Lee.
Hi.
How you doing?
I'm good. Thanks, Peter. Thanks for bringing me on.
I'm glad you're here.
I'm excited.
So I have a little personal story with Dr. Lee because at one point I had bruised my knee and I had gone to, I had a little swelling. It was like a dot. It was like maybe about that big, it's like a silver dollar. It was and it was a bump that was on my knee, and it obviously had filled with fluid, and it was a little warm and red. And it really didn't bother me, but I thought I would get that checked out. And so I went to my regular doctors because I'm like, okay, let's get some diagnostics. I pay for insurance. I might as well use it for something. And I actually made an appointment, went to the hospital, and they looked at my knee. And the doctor told me I had to take antibiotics. And if I didn't take antibiotics, then I could possibly lose my leg. It was that extreme. Like they were making it like this huge thing. And, I'm like, okay, well, there's a little bump on my knee. It's really not bad. It doesn't hurt. There's some fluid trapped there. And, maybe they were right in some way. It wasn't my truth. And I didn't want to take antibiotics. And when I questioned the doctor got really pissed off at me. He totally belittled me and asked me what I know about, am I a doctor? What do I know about medicine and stuff like that? And I did say that, I've had problems with my gut. And years ago, I was on a lot of antibiotics and my digestion got completely messed up. My health went down. And it took me a while to build up that good flora in my body again so that my body would feel healthy. And I didn't want to sacrifice that to something that I maybe kind of should take because he thought so. And so I left there with the prescription, with a piece of paper for the prescription in hand saying, well, all right, I'm just going to keep this as a background. I probably won't use it, but let me see what else I can do. And Clement is in a networking group I'm in. Well, not really a networking a group, more of a friend group that was created out in Pasadena near the area where I live in. And it's a community of people who are interested in integrative and holistic health. And it may be doctors, it may be holistic practitioners, all kinds of people. And I became friendly with Clement and I said, why don't I see what he has to say about this? And I went into his offices and he did a little bit of a drain and pulled out some fluid from there. And we did some ozone therapy. And within a day, the problem was healed. Within a day of actually going through, draining it out properly, and having that injection of some Prolozone, my knee completely healed. And that is a little miracle. No antibiotics, no other kind of really heavy-duty medical intervention, no losing of my knee or anything, having to have my knee replaced or leg cut off like the doctor told me. And that was really impressive to me because he helped me feel better in a way that was accessible, that was doable, that didn't require drugs and surgery. And for that, I am grateful. So, Clement, I imagine you see things like that all the time.
Yeah, we do. We see, just like a family doctor, we see everything from diabetes to cholesterol to more chronic severe cases like Lyme disease and a lot of orthopedic conditions. But the way that we treat is using a more holistic perspective. We look at the whole body, each person's individual, and we optimize their own healing ability, whether through nutrition, lifestyle, herbs, or regenerative injections like the Prolozone that we did for Peter here.
Right. So we're going to get into what Prolozone is because I'm some people can't even pronounce it, I'm sure. But you're a naturopathic doctor.
Yes.
What's the difference between a naturopathic doctor, which you guys are an ND,
That's
right?
correct, yeah.
What's the difference between an ND and an MD?
So it all comes down to our training. So we take the 4-year medical program, which is similar to medical school in the first 2 years, just like a medical doctor would. We have the basic sciences, we have anatomy, physiology, biochemistry, and pharmacology. But then in the last 2 years is where it varies a lot, and we learn a lot about nutrition, lifestyle changes, acupuncture, and a lot of holistic treatments to incorporate with the conventional care that we also provide. So we learn about the traditional laboratory diagnosis and even some advanced diagnostics, and then we combine it to a way that's more accessible for patients and actually getting to their underlying causes. So it's a little bit different. We're not just like medical doctors. We're not specialized into only looking at, for example, the kidneys or only looking at the breasts or the lungs, but we actually look at the whole body. And our training allows us to do so.
Right, so you actually get a background because
Yeah.
I know regular medical doctors, their real background that they draw from,
Right.
their education is basically drugs and or pharmacy and surgery.
Right.
Right, and that's exactly what I was offered, pharmacy and surgery. And I was even offered pharmacy and the threat of surgery,
Right.
which that didn't make me too happy.
Yeah.
So you looked at my knee and you kind of laughed and went, oh, it's just blah, blah, blah.
Yeah. Just some minor inflammation.
Right, which was funny because it was the complete opposite response of my typical MD. And so we did this thing called Prolozone.
That's right.
Okay, so people don't even know what Prolo is. So let's step back. Prolotherapy is something that I'm familiar with because, like in this knee here, I actually grew back all that blue stuff.
The cartilage.
Which all the cartilage, because the Western medical doctors, when I had my accident, I was slammed in that semi truck, right? And my knee shattered. The doctors pulled out most of my cartilage, which I thought was the weirdest thing. Why would they take it out? But they did. So I had bone on bone contact, and they put my knee back together because it was shattered into little bits, but I had no cushion between the bones.
Right.
And eventually I was told if I could walk, I wouldn't be able to walk very well, and I'd have to have my knee replaced by the time I was 40. And I had something select to say to the doctors, and I didn't believe them. And I went out searching for solutions. And before I met Clement, I found a doctor through UCLA who did prolotherapy. And I did straight up traditional prolotherapy. And they call it the pearl effect or the sugar shot, right? The idea that the granules of sugar are injected, so liquid sugar, right, is injected into the knee. The body responds to that those granules like a pearl, like an oyster does to a grain of sand, right? And it then creates something beautiful, which is cartilage. So I actually grew my cartilage back using prolotherapy. But you did something even more. You took it a step further in order to help my knee heal.
Right.
And that was the addition of...
The ozone.
Right.
Yeah.
Why ozone?
So ozone is naturally formed. It's actually whenever there's a lightning strike, the lightning activates the oxygen in our atmosphere. Well, the ozone is a reactive form of oxygen, so it actually has a higher energy state. And when it's entered into our body, it creates very many different pathways. So one of them actually helps to stimulate cartilage growth. One of them is actually an anti-infective agent, so it actually destroys any bacteria, viruses that are in the system, but it promotes healing as well because then it breaks down into oxygen, which all of your tissues need to heal.
Right.
So it's a very effective way to actually lower inflammation while at the same time promoting healing.
Right. And that's exactly what it did. Within a very short amount of time, suddenly there were no complications with my knee. My knee was perfectly fine. The swelling was gone. All the inflammation was gone. It was just back to normal.
Right.
Right.
Yeah.
One injection.
That's right.
That's ridiculous.
Well, some people need more, but your case was actually pretty acute, so it's not too bad.
Right. And talk to us about that. I went through this very layman's understanding of Prolo with, how I grew my cartilage back. And a lot of people may be shaking their head because traditional Western medicine says, Westerman, you like that? I made a new word. The basic medicine says that that's not possible. So how was it possible? Because I'm living proof. I have X-rays that I grew my cartilage back. And and my arthritis is practically gone.
Well, I mean, I'll start with the philosophy of what the regenerative injections, so prolotherapy is one of the many types of regenerative injection therapies that we do. But the whole concept is just allowing the body to stimulate itself to heal. With conventional medicine, you're given steroids or you're given anti-inflammatories, which may take away the pain, but that actually doesn't promote any healing. So with those modalities, typically there's no real chance for your body to grow back any new tissue because you're not stimulating any growth, but you're not actually allowing the tissues to heal because you're taking away the inflammatory response.
Right, and that's what most people do, right? We pop an aspirin or we take something like that that's going to actually remove the inflammation. And
but
although that may feel better for a little while,
but it takes away the healing process.
Right, we actually need inflammation in order to heal.
Right.
That's a concept that I bet a lot of people are confused about.
Right. So to take it a step further, there's two types of inflammation. So there's the chronic inflammation. This is like the low grade. We may have swelling in our knees if you have arthritis. It's not an active healing type of inflammation. So your body doesn't have enough stimulation that it needs to know that it actually needs to repair itself.
Right.
So what we do with the injections is we create an acute response. So we inject solution into the joint, and in the case of prolotherapy, we inject sugar. So sugar in its own is generally inflammatory. So if you eat too much, it's not so good for you.
But it's not going into your digestive tract.
It's not going to your digestive system. So when we inject it locally, for example, into the joint here, so we actually create a little bit of inflammation in there, enough to get the blood flow to know that this area is injured, and you get some swelling temporarily, but that is an acute swelling. And so from there, your body knows to actually heal itself. It brings in cells that bring in new cartilage. It brings in cells that actually take away waste products. And over time, the body naturally remodels itself.
Right.
So this is the type of injections that we do that stimulate the body to heal itself. A lot of times with the joints, ligaments and tendons, they don't get a regular blood supply. And that's the reason why if you may sprain an ankle or something, it doesn't ever get back to 100%. Or if you tweak a knee on its own, it never really feels right afterwards.
Right.
But with these injections, you get it to the body to recognize that it's injured again, so then you can continue getting it back to its original state.
Right. Now, when I did Prolo for the first time, like probably 10 years ago, and this is by my estimation,
Sure.
I went to a guy and I had a 40%, by my estimation, decrease in pain, and I had a 40% increase in my mobility. I could almost squat and bend my knee, my my ankle up to my buttocks, right? I actually could almost do that. And now with the injury I have, I'm not supposed to be able to do that.
Right.
And I can go into a complete squat. That's tremendous.
So your body has the natural healing ability.
It does.
You just have to
So
stimulate it.
typical Western medicine put my body back together, and naturopathic type of therapies really gave me my mobility back.
Right.
And so with that, we're going to be right back because we have some more questions we want to go into with Dr. Lee. And to stay tuned, we have a bunch of cool stuff coming up. All right, ciao. Hey everybody, thanks so much for tuning in. If you're interested, check out convergencehealingteas.com. You can try all of these yummy, delicious teas that are actually crafted in my home kitchen to help you feel better. We have a Sleep Well blend, a No More Anxiety blend, and all of those ingredients in there are designed to help you feel better through the traditional qualities that Mother Nature has to offer. Check it out. All right, so here we are. Welcome back. This is, I'm sitting down with Dr. Clement Lee, a naturopathic doctor, and somebody that I personally worked with. So I always like to bring guests onto my show that I have a personal experience with. Can't do that with everybody because, thankfully, I don't need to always heal myself anymore. I've done a lot of work on that. But this is Dr. Lee, and Dr. Lee, for those who didn't hear the first part, really helped me with a inflammation response that I was having in my knee. And the doctors, traditional doctors, were giving me antibiotics, and I had a 10-day antibiotic that I was supposed to go through. I was able to not do that to my gut, heal my body, with a very natural way, with this prolotherapy and this prolozone therapy. And it really changed my life. In fact, I actually I need to schedule some time with you because I want to do some booster injections on my left knee that I actually haven't had any work done on in probably 12, 15 years. Yeah. So just as I'm aging, and I had prolotherapy done quite some time ago, grew all my cartilage back, and I'm feeling like there's every now and then there's a little wobble. So I'm like, okay, we want to knock that out, and so I'll be coming to see you soon. Where do we actually inject Prolo?
So with prolotherapy, it's commonly injected into ligaments, tendons, and also into the joint space.
So show us where that.
Yeah.
So we have a spine.
So we have a spine
what's
here.
What's his name? Or?
Well, we don't have a name for the spine here.
All right.
Well, what you don't see on here are actually ligaments. So the knee is a better example. You actually see this orangish color, translucent tissue. Usually these are ligaments, and then there's a tendon that runs across, which is all connective tissue, and then you have your posterior collateral ligament and your anterior, so the ACL, everybody knows it as. So these ligaments are generally injured, and so what we do is we inject right onto where they attach onto the bone. So it sounds painful, and it generally is not as painful as you think it is.
It's really not, and I don't like needles at all. Careful about moving around on the table. So I don't like needles at all, and I'm able to go and do this, and it's fine. And you do some numbing.
Yeah, we use Procaine, so it actually numbs the joint. So same thing as if you go to a dentist.
And it's topical, right?
Yeah, it's local. It's a local. It doesn't go systemically, so it doesn't cause any issues. There's no side effects associated with it.
So you inject, and you have these injection therapies.
Yes.
Right. And so talk to us a little bit more about what that means.
Okay, so regenerative injection therapies, it's a big scope of different types of injections. So we have prolotherapy, which is a simple sugar that we use for injection. Prolozone takes it a step further, where we use some vitamins, amino acids, and ozone, which helps to stimulate it a bit further.
And is there a sugar in that, or is it just...
There's actually no sugar in there.
There's no sugar.
Yeah, it's just vitamins, actually. So it actually has a little bit of a inflammatory effect, but not as much as with the sugar, but you still get the healing process that comes with it. For those with a little bit more damage, in, let's say for cartilage or deeper tears in the ligaments, we have PRP, which stands for platelet-rich plasma. So for that one, we use your own blood, we spin it down, we extract the platelets. So the platelets are the growth factors that normally stimulate the healing process. So when you cut yourself, that very first scab that starts to form, the action is caused by the platelets. So we use that to enhance the healing a bit further. So that one's very commonly used nowadays to actually help repair cartilage tissue. A lot of big-name athletes have gotten their joints treated with PRP.
Right. I actually sent somebody to you. So I have a friend who I've known for, 16, 17 years now. And she, since I've known her, has had joint problems.
Right.
And she was a runner, and she was back in the 80s. I'm dating myself. She was a big, was it Jane Fonda? What is that? What was the whole aerobics?
Yeah.
She's all that step aerobics and dance aerobics, and she did all this kind of stuff. And, she really trashed her knees.
Right.
Really trashed her knees. And I believe she had major arthritis and hardly any cartilage.
Bone on bone, yeah.
Bone on bone, right?
Yeah.
And she was a candidate for knee replacement surgery. And I said, you know what? I know you've done all these other things, and I'm not telling you not to do the knee replacement, because if you need it, it's where you need to go.
Yeah.
But I said to her, try this Prolo stuff, and I got a guy for you to go to.
Yeah.
So I had her come to you, and she sent me a picture of those X-rays. What did you see? What was your before and after? What did you notice?
So we had, for example, using this knee, the cartilage on the X-rays was gone. So the knee was actually touching the other.
So all that
bone
blue.
was,
if you can see that, for those who are watching, the blue on this knee joint.
Yeah.
It's the space between the bones.
So it was bone on bone. It was completely there was no space left in there.
Right.
And so we actually started with the PRP, and For this case, we actually took it a step further. So there's a couple other treatments that we have that are even better than PRP. So one of them we call ozone clot matrix. So it's a combination of ozone with the PRP, but it activates the PRP so it stays in the joint longer like a cushion. So in this case, we actually were able to grow that cartilage back, and on the post X-rays, the spacing was back to normal.
Oh, back to it's amazing.
It was amazing, yeah.
Looking at one, I wonder if I can get those X-rays from her, because one image was there was no, you could X-rays are black and white, right? It's are hard. I don't read them that well, right? But you could see that the joint, the bones were right on top of each other.
Actually, I have the
there was no
X-rays on my phone.
separation. Oh, great.
Yeah, I can
okay,
show
well,
you
we'll,
later,
we'll get them, because there was no separation between the bone.
Yeah.
And then in the second X-ray, there was actually space. There was space between the bones. The bones, I'm guessing, had the ability to now move without coming in contact with each other.
Yeah. So prior to all the treatments, she had limitations. She couldn't do yoga at all for more than 5 minutes without
not
pain.
anymore, yeah.
Now she's just doing yoga and not even thinking about the pain.
Isn't
at
that
all.
awesome?
Yeah, it's
that's
amazing.
awesome. I'm so grateful for that, because she's a dear friend. I
that's
adore her, and for her to be able to have that physically active life back. Before she's a therapist now, but before she became a therapist, she was this trainer and all that type of stuff. And for her to have that physical sense of expression back, that's enormous for somebody. It's like somebody's heart.
Right.
The thing that they love to do, they couldn't do anymore, and you gave that back to her. So thank you very much for that. So when we look at the spine, I believe one of the biggest problems in the United States is spinal injuries. People having back pain of some sort. Tell us about that. Like, you brought this great spine. Tell us about how you help people relieve that kind of pain.
So one of the missing links with conventional medicine, even in alternative medicine, is strengthening the ligaments back. So you have acupuncture, chiropractic. These are alternative modalities that are actually really great. I mean, they're actually indicated first line for low back pain. But if those therapies don't work, a lot of patients don't know that there's an option before having surgery.
Right.
And so the injections that we do are actually that option there. So what people don't see, and you don't actually have it on this model here, are ligaments. So imagine like a suspension bridge. The cables in there are like the ligaments that keep that bridge intact, and your spine is like that bridge. So if you have any minor tears, this could be from poor posture, it could be from car accidents, it could be from slip and fall, it can be from overuse. Those ligaments will actually tear, and when they tear, they're more like rubber ropes than rubber bands. So they actually will shear a little bit. What happens in the long run is there might be some instability in the spine itself as a result of those ligaments just being a little bit looser than they once were. So what'll happen is the joints might be out of place. Well, your body doesn't like to let the bones fall apart, so the muscles around it will get really tight. So the most common presentation of low back pain is just muscle tightness or some stiffness. And what happens is that's a secondary effect. When the ligaments are weakened, the muscles have to overwork. So the muscles then work longer than they have to. And with a lot of the therapies that you're doing, you're not really addressing those underlying ligaments that are lax.
Right.
So with these injections, we're actually able to restore the integrity of those ligaments and restore the structure. Then at that point, the muscles can work as they normally would and not have to over utilize themselves. And then the pain will go away, and then the structure will come back, and then your body is just back to normal.
So show us what an actual injection would look like.
Sure.
You give people an idea of the needle, the size of the needle, and how you place it.
Yeah, the needle itself, I mean, this is just a cap for it. So if I take off the cap here, it's really tiny. It's about the same size as an acupuncture needle, just maybe slightly bit bigger. But the biggest thing is that we use anesthesia, so it numbs the area. So it's really, besides breaking through the skin, that's when the most pain is. When we inject into the area, you don't feel much of the pain. Like, there's no nerves directly where we inject. So an example is, there's a lot of ligaments that you don't see here. We just go right through the skin, and we do actually tap the bone. So it doesn't feel like very much.
Do?
Yeah, but
I've never noticed that.
Yeah,
so I've had these injections, and I never ever felt that. That's
so
crazy.
when we tap the bone, the ligaments are actually glued or kind of glued onto the bone, so to speak, and they adhere to the bone. So what we're trying to do is we're getting that attachment stronger again. And so when we hit the needle there, we actually release the anesthesia as well as the other nutrients that we're introducing. That stimulates the body to recognize that this area is now injured, recruits blood flow and nutrients and all the cells that activate the healing process. So over time, the tendons and the ligaments and all the connective tissue actually start healing back to its original shape and state.
So it's really about triggering the body to bring it back, bring its own healing response.
right.
So it's kind of like the trigger
Yeah.
that trips, that it's not tripping.
Yeah.
Right? The trigger is not being pulled, and the body is just going through this pain response. And so you kind of get the body to reset itself.
Right, right.
That's fantastic. Okay. Now there's other forms of injection therapy. Like I know when I've been to your place, and I'm fascinated by this. There's these IV drip type of things. Now I always associate that with being really sick. If you're getting an IV, that's when I've been really sick. I've been severely dehydrated, or I had this major surgery. Tell me just in a few minutes, what about this?
Sure. Well,
IV
one of our backgrounds as naturopathic doctors is nutrition. So we're experts at nutrition, and so we want to optimize the body's healing ability any which way possible. And so oral nutrition, sometimes it's great, but then if people can't absorb it or they need higher amounts of nutrients, that's when the IVs come into play. So the IVs allow the nutrients to bypass your gut and get directly into your bloodstream, which allows you to absorb a lot of these nutrients a lot faster. So in a state when you're needing some additional healing, or you're really sick, or you have some chronic issues where your body just doesn't have enough juice to keep up, that's when we can use these IV therapies.
Right. And I know we could probably all use that, right?
Yeah,
I mean, most of us in the world are pretty depleted of something. And if we've really driven ourselves too hard or pushed ourselves too hard, not with enough sleep, we're too stressed, all that type of stuff, then we can benefit from that, couldn't
Definitely,
we?
yeah. A lot of our patients come in for IVs because of the stress or because of fatigue or just not feeling well overall.
So it could be something that you do for management purposes.
Yes.
And it could be something you do to treat a bigger issue.
Definitely, yeah.
Right. So again, I'm all about helping people feel better, and I really want people to recognize that they have the ability to do that. And so you can either as a preventative type of thing or as a way to actually address this pretty serious issue. There are resources out there. So we're going to be right back in just a minute, and we're going to actually go over a couple other things. And I like your cute little collapsible puppet.
Yeah.
That's right there. we might bring that out in just a moment. All right. We'll be right back. Hey everybody, thanks so much for tuning in. If you're interested, check out convergencehealingteas.com. You can try all of these yummy, delicious teas that are actually crafted in my home kitchen to help you feel better. We have a Sleep Well blend, a No More Anxiety blend, and all of those ingredients in there are designed to help you feel better through the traditional qualities that Mother Nature has to offer. Check it out. All right, welcome back. I have Dr. Clement Lee sitting down with me, and he's been sharing with us some really practical approaches for feeling better, for actually addressing some pretty serious injury issues like arthritic issues or inflammation issues and stuff like that, from an approach that is about having the body trigger its own natural healing responses. And I think that's really valuable because although Western medicine has a place, and actually what you're doing is a form of Western medicine. It's kind of like a combination of holistic, integrative, natural, Eastern with Western. Yeah. It's this whole sort of merging field of stuff that's coming together. And I really like that because I think that we have more options than we know. And most people only feel like there's one way. Right? Like I have a client that's currently coming to me and she came to me for one session and then sent me an email back saying, I scheduled the surgery. I'm just going to go do that. Right? Like we didn't even we didn't even have time to get into the emotional, physical, spiritual response or why it's there, what it's about, or, getting her to go and try any other solutions. She's only done Western medicine. And I think there's so many other opportunities for her. But when you're in pain, you just want to be out of pain. So I'm very compassionate about that. And I understand, hey, this is a solution. She's been convinced that's the way to go. And it feels right for her. So awesome. And I'm supporting her in that. And my practice is switching from having her body guide her because she's not interested in her body guiding her, to having her body assimilate effectively what she's doing with the drugs and the surgery. So our focus is completely shifting.
That's great.
So it's great. Yeah, it is. I mean, it's something that she gets to decide. It's her body. I'm right there with that. So what is something that people can do, or what's something that you wish people would do that would make their lives better and possibly avoid them injuring themselves or needing your services even?
Well, For one is lifestyle. I think, with the standard American diet, that's something that contributes to a lot of inflammation unnecessarily. Sugar isn't too much of our foods nowadays. And, just limiting a little bit of sugar can make a big difference in pain,
And isn't that interesting that
Yeah.
we're talking about a sugar shot
Yeah, right.
injection compared to sugar that you're ingesting?
Yes.
So you're saying reduce the level of sugar that you're ingesting in your body.
And the thing with sugar, it doesn't have to be just candies or sweets. You're also looking at your refined carbohydrates, so the white rice or the white bread, and even pastries. People don't, necessarily associate sugar with starches. And so if you eat too much, the body has too much sugar coming in, doesn't know what to deal with it, and then it just dumps into your bloodstream. Well, then it can circulate everywhere and cause inflammation everywhere else in your body. And so that can end up leading to joint inflammation as well, because some of that sugar can then deposit in the joints.
Right.
And then you get this low-grade inflammation process.
Right.
Yeah.
I actually had a big inflammation issue, a while ago, and I went on a diet that was kind of like a paleo diet, an elimination diet, and I cut out, let's say I cut out wheat, and I cut out any kind of, pastas. I cut out nightshade vegetables, so I could eat lots of vegetables, but I couldn't eat the potatoes, sweet potatoes, eggplant, those types of things. I cut out dairy, and what else did I cut out? I think basically any kind of sugar, dairy, dessert type of things. And my whole body shifted.
Yeah.
Now, my pain didn't go away, but I felt better and I felt stronger. And the parts that were in pain dropped down. Like the level of the pain sharply decreased.
That's great, yeah.
And that was pretty amazing. So, I've gone back to some of my old eating habits and stuff like that, but I've really consciously am aware, I'm not going to eat as much of those foods. And I notice that when I do eat them, like especially around the holidays this last time where there were cookies and breads and all that kind of stuff all over the place, I was hurting.
Right.
And it was very subtle, and it happened over a few days. So it wasn't like an immediate type of response, like a gluten response. It wasn't like that. It was just my body, the inflammation level in my body went up.
But now you're aware of it. So
But now I'm aware of it.
That's the biggest thing.
Yeah, exactly. And I know, okay, go ahead and indulge a little bit, but don't keep doing it. Back it off.
Yeah, because some people have this level of pain that they just don't know what it feels like to be pain-free. So once you can get rid of that pain and those things might be causing the pain, then it makes better sense. And they might be able to indulge once in a while, which won't cause that bad. If they're eating all the time, that makes a bigger difference.
Right. And so there's another suggestion for you guys. Even if you have any kind of swelling, any kind of inflammation, any kind of chronic sort of pain response, lower your intake of things like those processed white flours or rices and stuff like that. Really good advice. Anything else?
Well, hydration. I mean, we
Hydration.
talk about this with all the patients. I mean, hydration is very important too.
Sure.
So if you don't get enough hydration, you're not getting enough blood flow to certain organs that need it, but you're also not eliminating enough waste products out of your joints as well too.
So you know what? That opens up a whole little area. And we don't have a lot of time, but I want to jump into that since you brought it up, and I've been wanting somebody to ask us to. So okay, water.
Water, yes.
All right, water. We all know we need water, right? LA water is supposed to be some of the best in the country. It actually wins taste tests, blind taste tests. It wins those taste tests around the United States when they take water from different municipalities and they have people taste it. But there's chlorine, and now nationally, I believe everywhere, most every place that resisted now has it, fluoride. So, and then there's the whole bottled water controversy.
Yeah.
Right? There's a whole thing about bottled water being no better, even though we
It's just tap
think
water.
it is, right? So, how do we hydrate?
Well, you want to try to get filtered water if you can. I mean, generally, if they're glass bottles, it's better storage, because with the plastics, you have a chance of all the chemicals in the plastics leaching out, especially if they're transported in heat. And you're also, they're not biodegradable as well. So from that standpoint, but for health-wise, glass bottles are always better if you can. But if, simple
Great
things you could do,
suggestion.
you just get a filter. I mean, there's different levels of pricing on filters, but the more you spend actually does make a difference. But if you can just get basic $100 or less filter, that makes your water a lot safer for you.
Great. Okay, so good. So if what you have accessible,
Yeah.
more water in general. If you can get a better quality of water, raise the bar.
Yeah, and then the amount of water, that's how much people should be drinking. So, there's a study out of Harvard a while ago, but it just basically recommends about half your body weight in ounces. So this is what I tell all my patients.
Yeah.
So just imagine your body like a toilet bowl. I mean, it's a very graphic way to describe it, but if you're made about 70 to 80% of water, so imagine if you're flushing your toilet bowl with just pure water, you'll clean the bowl all the time. But if you don't drink enough water to adequately flush, then that toilet bowl is not going to look so pretty afterwards.
So, okay, wait, I weigh 160 approximately, right? So that would be, cut that in half, would be 80
ounces, yeah.
So 80 ounces.
Yeah.
So I need to drink 80 ounces of water. That's a lot.
It sounds like a lot, but what you got there is probably close to at least 60 ounces. So if you drink that,
that's a lot.
Spread out
You
throughout
mean
the
just
day,
this,
though.
this level here? Or
No,
you
all
mean
the way up, yeah.
That's a lot of water.
But if you spread it out throughout the day, first thing in the morning, you drink
Right.
2 cups, you've cut down half of that already.
I try to. I've started a kick on where I try to drink water with just lemon.
Yeah, that's great.
And I just get a fresh lemon, I put that in the water, and I try to drink that. And I found that that's a nice sort of coming back in from sleep and the digestion of the night. It's a good balance for my body. All right.
So it makes a huge difference.
All right. Well, I am going to drink more water.
Great.
How can people find you?
So we have our website, which is opthealthwellness.com. So OPT short for optimal. And we also have our Facebook, which is facebook.com/OPT And you can visit the website, and we have a lot of good resources on there about all the different services that we do. One topic that we didn't get to cover, which were stem cells, but we have a lot of information on that as well. So it's great for helping patients out with some resources that are out there, and
Awesome.
that's great.
Great. Thank you. And, I've Googled you before. So
Yeah.
if you just actually do a Google search for Dr. Clement Lee, you'll find a lot of really good stuff on him. You're starting to produce some videos, too.
Yes. We'll
That's
have videos
beautiful.
on IV therapies later on as well, too,
Nice.
and as well as more information about these shots.
Yeah. So, you guys, I'm all about helping you feel better. I know I've said that before, but it's a truth. And it's part of my life purpose that I help people like this and Dr. Clement Lee actually share their message in the world. It's really important to me. They helped me change my life, and I want the same for you. I want you to feel better. I want you to live joyously, and I want you to shine brightly. So with that, thank you for tuning in. Remember, you could always leave us a comment. We love hearing from you. Give us a message on SoundCloud. Send us a message on Facebook. You can find us at Convergence Healing all over the web. Let us know what you think. And if you have any suggestions for future episodes, or you have a situation you need some help healing, send a message to me, and I will do my best to find somebody that can help you with that issue. And we'll put them on the show and have them address that issue directly. So thank you so much for tuning in. Make it a great day. Make it a great life. And thank you for being here. Take care.